Well, good evening, board members and guests who are watching, live streaming, or in the audience. Tonight, I'm going to devote my superintendent comments solely to the spread of the coronavirus and the impact it's having in Westminster Public Schools and what we're doing about it, and some of the team will be helping me with that. And so as we're getting into that, I'd like to acknowledge our mayor of the city of Westminster, Mayor Atchison, he's here, and also Don Tripp, our city manager, and Chief Hall from the fire department in city of Westminster. Thank you for being here. We're Westminster Public Schools, and the city has 3 school districts. I could tease my colleagues in Jeffco and 12 and say they do like us best, but that would probably put the city in a bad spot, so I won't do that. But I do thank them for being our partners in all things, good and bad. And so we are a community, and we say in Westminster Public Schools we are a family. And I believe in the city of Westminster, we're the same. We're a family as well. So thank you for being here tonight. As most of you know, this is an hour-by-hour fluid situation. And so Governor Jared Polis earlier today, declared a state of emergency here in Colorado. And as a part of that declaration, beginning tomorrow, the state will have a drive-up testing facility for anyone who has a note from their doctor stating that they need to be tested for COVID-19, is what we're calling it. The governor also directed the Colorado Department of Labor and Employment to engage in emergency rulemaking to ensure that workers in the food handling, hospitality, childcare, healthcare, and education industries get paid sick leave to miss work if they exhibit flu-like symptoms. Please know I'm in continual contact with other superintendents around the metro area, the Colorado Department of Education, and Commissioner Katie Anthus. And plans are constantly evolving as we try to find the proper balance between health and safety, risk management, and the educational needs of our community. And so I'll keep everyone informed as appropriate. We have created a guide for the community to answer questions about the virus and how WPS is responding. And do we have a picture of that, Veronica, up on the screen?
Till later.
Not till later? Okay, well, then I'll be quiet. You know more than I do. But it looks like this. I'll just hold that up. We do have a few copies. There we go. We do have a few copies for the public tonight. I'll leave out. We are in the process of printing more. And of course, we'll have this electronically. So I'm just going to pass these to the end, and maybe Joe would help us by putting them up there for anyone who may want to look at one. We also have this available online at mywps.org/coronavirus. So I've asked department heads, Dr. James Duffy, Dr. Oliver Grenham, and Steve Saunders to prepare a portion of this report for our community about our response to the coronavirus. And the report will be archived and shared with the community in our What's Up WPS electronic publication. And What's Up usually goes out on Wednesday morning, but we have rescheduled it for Thursday to better share our information. So Dr. Duffy, I'm going to turn it over to you for the first portion of this.
Good evening, Mr. President, members of the board, and Dr. Swanson. To understand where we are, we need to understand where we've been. In 2006, the H5N1 virus, the avian or bird flu, started to jump from country to country, raising concerns of a possible pandemic. While the healthcare field was well versed in planning for large-scale medical emergencies, this was something new to the education world, and with the help of state and local health agencies, we developed our first pandemic preparedness plan. 2009 brought the H1N1 virus, which proved to be more serious than the earlier bird flu, and we updated and enhanced our preparedness plan at that time. It was also during the H1N1 epidemic that we entered into an agreement with Tri-County Health Department to use our schools as community vaccination and response sites. This event led everyone, districts, Tri-County, and state health departments to realize we needed formal agreements for faster mobilization in the event of an emergency. So in 2012, we entered into our first 5-year mutual aid agreement with Tri-County to serve as local vaccine dispensing sites in the event of the occurrence of an emergency epidemic. I should also note that we have a separate agreement with Tri-County to assist in the mass distribution and dispensing of medical countermeasures in the event of a bioterrorist attack. For example, an anthrax attack in the community. So we have a long history of working closely with Tri-County. I believe it is important for you to have this background so you have an understanding that planning for an event like the present coronavirus is unfortunately the new reality for school districts, and an understanding that planning for the current event didn't start a month ago. It started years ago. I also think it's important for you to have an overview of what is in our pandemic preparedness plan. The goals of our plan are to limit the number of illnesses, reduce the spread of the virus within our schools, preserve continuity of essential school functions, minimize educational and social disruptions, minimize academic and economic losses, and work with local and state health departments to coordinate our responses. So how is this done? First, we need to understand the nature of the epidemic. We work closely with public health officials to understand the epidemiology of the virus, the symptoms, patterns of transmission, the who, where, and when of the virus. We then monitor these factors in our schools. Has there been an increase in absenteeism? Is there a pattern or similarities in the absences? We start tracking the data. While we always promote and advocate good hygiene, we start messaging the importance of good health habits and precautionary methods. We also encourage students and staff to stay home if ill. If a student or staff member becomes ill during the day, we practice site-based isolation until the individual has an opportunity to leave the building. And throughout the process, we increase our cleaning efforts and sanitization of our buildings. Communication to staff and community is ramped up, plans for distance learning explored, and how we provide essential services such as meals and mental health support for families in crisis all need to be considered. Now, in alignment with our plan, what have we done to date? The first coronavirus case was detected in China in late December 2019, and the first death reported January 11th, 2020. Globally, we were still in the early stages of understanding this virus. On January 21st, the first case was confirmed in the United States. It was at this time the operations team started discussions regarding our game plan on cleaning and disinfecting our buildings and buses. Team members were charged with reaching out to our custodial supply providers to determine what products were effective against the virus and what industry experts were recommending in the way of cleaning regimes. Within a week, the number of confirmed cases in the United States had jumped to 5. And on January 30th, our nurses sent out material from the Colorado Department of Health to all principals and site-based health providers, which included information on the virus and basic preventative measures, encouraging staff to review basic influenza hygiene measures with students and parents. I think it is an important quote from the letter that will give you an idea of how complex designing a response protocol to an emergent epidemic is. The letter states, "It is too soon to know how severe 2019 nCoV is compared to other coronaviruses or how easily it can spread from person to person. At this point, I want to stress that while a lot was still not known about the virus, within a month of it first being detected, the district had already explored mitigation protocols and had started communicating with our staff. The one thing we did know at this time was that this was a respiratory disease, and at the beginning of February, meetings with custodial staff were taking place to discuss the recommended cleaning products and directing them to focus on surfaces and items that were more likely to have frequent hand contact: doorknobs, light switches, keyboards, computers, desktops, drinking fountains, etc. Procurement also increased ordering of sanitizing wipes, hand sanitizers, soap, mask, and other related products. Getting orders in early has allowed us to be well stocked in the warehouse with these products. From the end of January to the middle of February, the 5 confirmed U.S. cases jumped to 15. Worldwide, hotspots were popping up, with Italy of particular concern. The Front Range Chief Operating Officers and Superintendents started discussions on foreign travel. While we didn't have anyone going to Italy, the Westminster Academy of International Studies was sending a group of students to France in April. Not only did we need to tailor our response to local conditions, we now needed to address conditions at a global level. By early March, France closed 120 schools in and around Paris to help contain the spread of the virus. We took the definitive step of postponing this trip. At the end of February, we updated the Board of Education on our efforts to date. Statewide, the communication directors began coordination on how to communicate with school communities. The challenge, as Mr. Saunders said, was how to keep parents informed without alarming them, and as a district, we went live with a coronavirus webpage on February 27th. The 1st of March brought conversations about, if we had to close school, how would we extend learning for our students? And Oliver will have more on this in just a moment. What I hope this overview has provided is some assurance that the district has been proactive in our response to the growing pandemic. Based on our experience with the earlier H1N1, we tried to anticipate the inevitable spread of the virus and start a cleaning and informational campaign early. We want life to continue as close to normal as possible. However, we realize there are some aspects of the current pandemic that are forcing us to be reactionary, though we hope our actions are reasoned and well thought out. You heard just today the governor has called a state of emergency in Colorado, and Dr. Swanson will be highlighting some decisions we have made this afternoon. We're into uncharted waters, but our foundational plan is solid, and we have the flexibility and capacity to respond to the ever-changing landscape. Oliver will now walk you through our instructional programming.
Mr. President, members of the board, and Dr. Swanson, the coordinated communication and response to the current coronavirus is very important. We on the instructional side of the House have continued to emphasize the importance of maintaining focus on the upcoming CMAS state test in early April. Later this evening, you'll hear about those efforts at 2 schools, the Metropolitan Arts Academy and Random Middle School. While endeavoring to maintain the instructional and learning focus, we've also been planning on how to best leverage our current technology to extend at-home learning, or as we like to call it, anywhere, anytime learning. As the board knows, Westminster Public Schools prioritized our financial resources over the years to ensure a one-to-one computing power for students, as well as creating a solid network infrastructure throughout the district. Consequently, Westminster Public Schools is one of a small number of school districts in the state that has accomplished this. Furthermore, over the years, Westminster Public School has been purposeful in adopting curricular programs that have a digital platform, and the most recent being Envision Mathematics. But as you can see from the slide, there are several others, plus many free online programs such as Khan Academy, plus schools are also leveraging a variety of supplemental online resources with students. It's important to note that students and teachers are very competent in using Chromebooks as part of the classroom learning experience. However, we have not used Chromebooks outside of the school setting to this point. Therefore, last Thursday we met with principals to identify the steps that we would need to take to make the home use of Chromebooks a reality. Several steps and issues were identified. The first was having a Chromebook home use agreement on file. This agreement outlines the expectations and responsibilities for use, as well as identifying the households that do not have internet access. Schools are currently distributing and collecting these. We also realized that we would need to order additional power cords and carrying cases, which unfortunately may take up to 3 weeks for delivery. Nevertheless, schools are in the planning phase of ensuring that all students have documented their usernames and passwords for all the instructional sites used for learning, as well as practicing their use. Schools are also developing a process to assign a Chromebook to each student, and they will be using to teaching students a digital code of conduct for home use, not unlike their regular classroom code of conduct. We're also working on a guidance document to support parents in monitoring their children when online. Hodgkin's Leadership Academy will pilot overnight student usage of Chromebooks with a sample group of students in the coming days. We can use this information that's garnered from this experience to decide how best to grow anywhere, anytime learning across all performance levels and in all schools. However, for the younger children, essentially those in pre-K2, principals thought it best to prepare student packets to include learning activities, review worksheets, level books, etc. for use at home. And finally, we're in the process of developing protocols for principals to be able to communicate with teacher and students should an extended closure be implemented. But I think a key point is to reinforce staying calm during this time with a lot of information coming at all sides from all sorts of media, and keep the focus on learning while kids are in school.
Thank you, Oliver. Mr. President, members of the board, Dr. Swanson, the Communications Department certainly believes that knowledge is power, and our goal is to share accurate information with families and staff in a timely manner. As Oliver said, while this is certainly a serious issue, we are doing our best to limit rumors and that sense of hysteria. As Dr. Swanson mentioned, the Communications and Operations Department put together a community resource guide that is available to the public at mywps.org/coronavirus. That's what the cover of it looks like right there. It is hoped that this guide will empower families to make smart decisions and keep them informed about the decision-making process at the district level. We will also email it out to families as well. And for those who have not looked through it yet, it's fairly short, but what we decided to do was to create something that was very graphic heavy so that parents could sit down, share it with their children as well. In fact, one of the sections in here is talking to children about COVID-19, how to reassure them, how to make them feel secure, and realize that that while it is a serious concern, that serious steps are also being taken. It's really important because I think you guys as parents and Board of Education members have heard a lot of that, people wondering what is too much and where should we be. So we feel like this will be very, very helpful to people. Family and staff are already very familiar with our different communications platforms. They are the same systems that we use for school closures or delays because of weather or emergencies. Our Blackboard communication system, as you can see up there on the graphic, allows us to directly connect with people via telephone, text, or email. There is a component that's incredibly important for the community to take note of. It is critically important that the district has correct phone numbers and email addresses for everyone connected to the system. Families who need to update their information should contact the front office at their individual child's school. District employees should contact the HR department because we can be sending this information out, and it has happened in the past, and people say, I never heard about it. We go back and check and that their email was out of date. So that, for folks watching at home, is critically important to make sure that the school has your right information. Now, we also continue to update our district and school web pages along with our Facebook and Twitter accounts. Many of you have probably seen this important message that has gone up on all web sites first thing in the morning. You have to click to acknowledge that you've read it, then it disappears to the lower corner. But it does keep you updated, and in fact the latest message, you can't read it there, but it did inform people that we would be live streaming tonight's event as well. So what's also very important is, as we've all seen in this social media age, is that we are encouraging people to not share speculative tweets or Facebook posts that provide bad information. If there were to be a school closure or a major change in plans, we, the district, would share that information. In fact, we know that last week there was a Facebook post going around in Jefferson County that said all schools were closed for the week. Obviously, that wasn't the case, but we know how people respond and start sending things. So again, anything of that nature would actually come from the district. Finally, I would tell you that the school district communications departments across the state are in regular contact with each other, as well as the Colorado Department of Education Communications Department. We do this through an organization known as COSRA, the Colorado School Public Relations Associations. We are able to head off rumors that are floating around out there, media requests, people are asking questions, and just generally share information, what has worked, maybe what has not worked. And we also, of course, receive and share information with the local health agencies as well. Dr. Duffy had talked about some of the briefings that we've listened in on and have been a part of as well. So I know Dr. Swanson has some more updates, and then if you have questions for the three of us, we'll be glad to come back up and answer those questions best we can as well. Dr. Swanson.
Thank you, Steve. And as I said in the beginning, this remains a very fluid situation. And when the commissioner has written several emails this past week, she's made it clear that although we don't know what flexibilities districts will need, whether it's waivers regarding instructional time or anything else, we'll face those as we go because we are in a bit of an uncharted territory. But we will definitely make the promise to stay in continual communication with our families and our staff as necessary. And there are a couple of pieces of information I want to share right now. These are not decisions that are made very lightly at all. And everyone probably has an opinion, but at the end of the day, we have to do our best to err on the conservative edge when it comes to keeping staff and students in our community safe. We decided late today to postpone the high school musical of Beauty and the Beast. It was scheduled for next weekend, but given all of the uncertainty about coronavirus and its impact, especially on the elderly population, we had to make a very tough decision about the show. The good news is it has been tentatively rescheduled for May 1st, 2nd, and 3rd. So that information will be going out, and I have it on good authority that if folks have already purchased tickets through the Creative Arts Pipeline Office, we will either be refunding those or giving credit for the show later in May. Friday was scheduled as a parent-teacher conference day in a couple of our schools. In working with principals, what we've decided to do there is to have those sessions conducted now by phone and giving parents notice about that, so they still have that opportunity to have a conference, but we'll be doing that by telephone. We're also taking a close look at schools and what we would consider to be large gatherings at schools for different reasons so that we can make informed and common sense decisions about those and how that might affect closures of some events or postponement of some events like I just described with our musical. And late today, the Colorado High School Activities Association, CHASA, released a statement saying that as of now, the plan is to conduct the championship events unless directed by state agencies and or facility administration of cancellations. I do know that they're in a fluid situation just like we are, and so we're having to look at changes almost on an hourly basis. And then finally, a word about travel for students and staff. I've drafted a letter explaining our decision to impose some travel restrictions, at least for now, so I'm going to read that to you to close out my report. This will go out after the board meeting this evening and into tomorrow. Dear Westminster community, I'm writing this message to our Westminster Public Schools families and employees to provide information about the district's decision to immediately suspend travel, both in-state and out-of-state, for school-organized or sponsored student trips and staff professional learning. We are closely monitoring CHASA-sanctioned activities along with other school districts, and as I'm talking to my colleagues, superintendents across the metro area, just like we try to make good decisions collectively around bad weather days, we'll try to make some good decisions around these events too. This is upsetting and disappointing for many, but out of an abundance of caution and safety for our students and community, we feel this is the appropriate decision as we try to make clear as often as possible the health and well-being of students and staff and our community. These are always our highest priorities. These travel restrictions are to remain in effect until further notice, and it's my hope to revisit these travel restrictions once spring break is over. Spring break for Westminster Public Schools is the week of March 22nd. And if you have travel plans, whether your staff or community, please remain aware of health advisories and conditions that might impact your plans both to and from your destination. During the break, we will provide regular updates about any changes that would affect operations. And just to reemphasize what Steve Saunders just said, please do not rely on communication that comes from any other source other than Westminster Public Schools. Kindest regards. So that's what will go out to our community. And at this point in time, that concludes my report. And we can revisit questions in study session, or we can have more now. It's at the board's pleasure.
Thank you. Board questions or comments for Dr. Swanson and our team? I'd just like to acknowledge all the work. I know that this is an evolving situation and will continue to be so, and there's a lot of uncertainty out there, so I appreciate that you continue to monitor and keep us informed.